Hi guys! Vivian's here, postcard from Cebu.
Health insurance in the Philippines. I've been doing some research because you guys asked me to, and I've been looking into it. There are many options, actually. There are quite a few options that you can avail yourself of. So I'll discuss a couple of those, and I'll also in the comments, not the comments, in the description below, I'll leave a couple of links for you guys to kind of check out some stuff on your own with respect to health insurance. The first is the government health insurance company, which is called Fil-Health, Philhealth, Fil-Health. And Fil-Health, at first I thought would only be available to Filipinos. Turns out it's not. It's also available to retirees and foreigners who live in the Philippines. So that is something you can avail yourself of. It costs about 3,000 pesos, which ain't a lot. I think a year. And hopefully the guys that are more knowledgeable about these things can chime in the comments, but I'm guessing it's 3,000 pesos is what, 70 bucks, 75 bucks a year? Not a bad deal. I think it only covers you in a public hospital, and that's only for like emergencies if you're admitted to the hospital. But for those of you that are on a budget, there's your backup plan, Fil-Health. You do have to have what they call an ACR card. An ACR is an Alien Certificate of Registration. Some call it ACRI, and the I is just for identity card. But if you're actually living in the Philippines, you get an ACR card, and you can also apply for Fil-Health. So that's, for those of you that are on a budget, that's a good way to go. I was surprised to find that a lot of big name health insurance providers also provide insurance for expats in the Philippines and elsewhere, actually. Probably the biggest name that popped out to me was Cigna. Cigna, Cigna. I know that because the company I work for provides insurance for me through Cigna. Also, my mom, and a lot of you guys may already know, but my 95-year-old mom lives here in my house with me, which is why Vivian sometimes teases me about being part Filipino. But anyway, her health care is provided by Social Security Administration through Cigna. Cigna has a program for expats, and you can check it out. As a matter of fact, at the end of this video, I'll leave a screenshot up that I did from a website called expatfinder.com, and I'll leave that screenshot up, and you guys can search on that and check it out. There were 4 different health insurance companies there, Cigna being one of them, AXA, which I've heard of before, and they call it a PPP, which I guess is a preferred provider network. William Russell, and another one was Expat Plus. So there are several options for additional insurance if you want to go with that. But to be honest with you, having bare bones in case of an emergency, Fil-Health at 3,000 pesos per year does not sound like a bad deal to me. As a matter of fact, I may buy that for Vivian, myself, and our stepchildren just because it's so inexpensive, and it gives you emergency coverage if you need it. I will also, of course, I'm still a few years away from pulling the trigger on full retirement, so I still have some time to investigate. But I would definitely look into Cigna and AXA and the others they may provide even better coverage and lots of other perks for you. So anyway, guys, given the short time frame that I was able to do this research, that's what I have. Hopefully the more experienced guys can chime in the comments and give us more in-depth discussion about what those options really mean, and if there's any gotchas involved with that, especially with PhilHealth, because I don't know much about it. PhilHealth is the Philippines government's national insurance plan, if you will. I guess the Obamacare of the Philippines. But anyway, that's what I got so far, guys. Thanks for watching. Up there somewhere is that subscribe button. Hit the subscribe button. We'd love to have you with us. And also feel free to leave any comments below. I especially like to hear from the more experienced subscribers who know more about healthcare in the Philippines. Let us all know what your thoughts are. Thanks for watching, guys. Bye.